Great question. And notice that they said infection prevention instead of infection control, because we don't want to control infection, we want to prevent it. Our new distributor in Austria just had a client that asked this same question. They were a hygiene officer, so maybe that's what they call it over there in Austria. Although it does have antimicrobial properties, which help inhibit the growth of mold and bacteria on the clasp and in the clasp, it doesn't replace the need for regular cleaning and maintenance. Note, you can't sterilize this with an autoclave machine because it will melt. Now we're going to talk about how to clean it using wet to dry method. Okay, I tried to memorize it, but I'm just going to read it, okay? The wet to dry time in the context of using germicidal solutions to clean hard hospital surfaces refers to the specific duration that the disinfectant or cleaning solution must remain wet on the surface in order to effectively kill or inactivate pathogens and remove contaminants. What you do is you essentially saturate the surface, any hard surface, so it can be this or it can be the mattress of the hospital bed, with your germicidal solution. Then you wait. It sits there and it dries. While the surface is wet, it's doing its killing, and it dries to complete the process. So yes, if you dry it, wipe it dry before the allotted time or the evaporation process, you might not get the 100% effectiveness of the germicidal solution. I don't know if this makes sense. I will just tell you what I've seen in hospitals. When I used to watch housekeeping clean the patient's room, they would take the solution and kind of either like on a wet rag, just like squeeze it and saturate the hard surface. Then they would like clean other things, wipe down the bed rails with the wet solution, and the solution that was wet on the mattress would just dry. Now, I don't know how this works in other states because I lived in Nevada, and I will tell you the humidity factor is very low there, so things dry in an instant. Did this help at all with the answer to that question?